Cardiopulmonary Resuscitation, CPR. Introduction. Cardiopulmonary Resuscitation, CPR, is an emergency life-saving procedure performed when the heart stops beating. It combines chest compressions and artificial ventilation to maintain circulatory flow and oxygenation during cardiac arrest. Early and effective CPR increases the chances of survival and prevents brain damage due to oxygen deprivation. Definition. American Heart Association, AHA. Cardiopulmonary resuscitation is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest. World Health Organization, WHO. According to the WHO, cardiopulmonary resuscitation, CPR, is a life-saving emergency procedure that involves chest compressions and rescue breaths to restore breathing and circulation when someone's heart has stopped. Indications for CPR. Cardiac arrest. CPR is performed when a person has no detectable pulse or heartbeat due to sudden cardiac arrest. Respiratory arrest leading to cardiac arrest. If a person stops breathing, example due to drowning, drug overdose, or choking, and progresses to cardiac arrest, CPR is required. Severe arrhythmias, life-threatening arrhythmias such as ventricular fibrillation, VF, or pulseless ventricular tachycardia, VT, may require CPR if the patient collapses. Electrocution injuries, electrical shocks can cause sudden cardiac arrest, requiring immediate CPR. Drowning, CPR is indicated if a drowning victim is unresponsive and not breathing normally. Drug overdose, opioid or sedative overdose can cause respiratory and cardiac arrest, requiring CPR and possibly naloxone administration. Severe hypothermia with cardiac arrest. In cases of extreme cold exposure, CPR should be initiated if the person is unresponsive with no pulse. Choking leading to cardiac arrest. If an obstructed airway causes suffocation and leads to cardiac arrest, CPR is required after attempting to clear the airway. Shock leading to cardiac arrest. Patients in severe anaphylactic, hypovolemic, or septic shock who progress to cardiac arrest need CPR. Sudden collapse with unresponsiveness. If a person suddenly collapses, is unresponsive, and has no pulse, CPR should be initiated immediately. Contraindications of CPR. Do not resuscitate, DNR, order. If a patient has an advance directive or legal DNR order in place, CPR should not be performed. Signs of irreversible death. If there is evidence of biological death, such as rigor mortis, livor mortis, post-mortem lividity, or decapitation, CPR is futile. Severe terminal illness. In cases where the patient has an end-stage terminal illness, example advanced cancer, multi-organ failure, and CPR would not provide meaningful survival, it may be contraindicated. Massive trauma or non-survivable injury. If the patient has suffered catastrophic injuries, example severe head trauma, exsanguination, CPR is unlikely to be effective. Prolonged downtime without signs of life. If the patient has been in cardiac arrest for an extended period without CPR and there is no return of spontaneous circulation, ROSC, resuscitation efforts may not be beneficial. Underlying severe neurological damage. If a patient is in a persistent vegetative state or has irreversible brain damage, CPR may not improve their prognosis. End-stage organ failure. Patients with conditions such as end-stage heart failure, end-stage COPD, or liver/kidney failure may not benefit from CPR, as resuscitation would not restore quality of life. Uncontrolled sepsis or severe infection. In cases of overwhelming sepsis with multi-organ dysfunction, CPR may not be appropriate. Futility based on medical judgment. If medical professionals determine that CPR would not achieve a meaningful outcome, they may withhold resuscitation based on ethical considerations. Types of CPR. CPR is classified into different types based on the technique used, the responder performing it, and the situation in which it is applied. The main types of CPR include conventional CPR, standard CPR. White heavy checkmark definition. This type of CPR involves a combination of chest compressions and rescue breaths. It is the most widely recognized and recommended for laypersons and healthcare providers. White heavy checkmark steps. Check responsiveness and breathing. Call for emergency help, example ambulance. Provide chest compressions at a rate of 100 to 120 per minute. Give rescue breaths, 30 compressions followed by 2 breaths. Continue CPR until professional help arrives or the person recovers. White heavy checkmark best suited for adults and children who experience cardiac arrest due to asphyxia, example drowning, choking. Situations where trained rescuers are available to provide mouth-to-mouth breathing. Hands-only CPR, compression-only CPR. White heavy checkmark definition. This method involves only chest compressions without rescue breaths. It is recommended for untrained bystanders or situations where mouth-to-mouth breathing is not feasible. White heavy checkmark steps. Check responsiveness and breathing. Call emergency services. Begin chest compressions, push hard and fast at 100 to 120 per minute. Continue compressions until emergency help arrives. White heavy checkmark best suited for witness sudden cardiac arrest in adults. Bystanders who are untrained or uncomfortable giving rescue breaths. Public places where immediate action is needed before professional help arrives. White heavy checkmark effectiveness. Studies show hands-only CPR can be as effective as conventional CPR for adult cardiac arrest victims in the first few minutes. High-quality CPR, advanced CPR by healthcare providers. White heavy checkmark definition. A more refined form of CPR performed by medical professionals, emphasizing proper technique and advanced life support interventions. White heavy checkmark key features. Proper depth and rate, 2 inches deep, 100 to 120 compressions per minute. Full chest recoil after each compression. Minimal interruptions in compressions. Use of advanced airway devices, example endotracheal tube, bag mask ventilation. Monitoring via ECG to determine heart rhythm. White heavy checkmark best suited for hospital settings, emergency rooms, intensive care units. Patients requiring advanced life support interventions. Situations involving defibrillation or medication administration. Infant and pediatric CPR. White heavy checkmark definition. Special modifications of CPR techniques for infants, under 1 year old, and children, 1 to 8 years old. White heavy checkmark key differences from adult CPR. Compression method. Infants, use 2 fingers for compressions. Children, use 1 or 2 hands, depending on size. Compression depth. Infants, 1.5 inches, 4 centimeters. Children, 2 inches, 5 centimeters. Breaths, deliver softer breaths to avoid lung damage. Compression to breath ratio. Single rescuer, 30 compressions, 2 breaths. 2 rescuers, 15 compressions, 2 breaths. White heavy checkmark best suited for infants and young children experiencing respiratory-related cardiac arrest. Situations such as drowning, choking, or respiratory infections. Mechanical CPR. White heavy checkmark definition. The use of mechanical devices to perform chest compressions automatically. These devices ensure consistent, high-quality compressions. White heavy checkmark types of mechanical CPR devices. Lucas, Lund University Cardiopulmonary Assist System uses a piston to deliver compressions. Autopulse, a low distributing band that squeezes the chest to simulate compressions. White heavy checkmark best suited for emergency medical services, EMS, and ambulances. Long-duration resuscitation efforts, example during transport. Situations where manual CPR is difficult, example cardiac arrest in moving vehicles. Prone CPR, reverse CPR. White heavy checkmark definition, CPR performed when a patient is lying face down, prone position. It is rarely used but necessary in certain cases. White heavy checkmark key considerations. Used when turning the patient is impossible, example patients with spinal injuries, during surgery. Requires specialized training and techniques to ensure effectiveness. White heavy checkmark best suited for surgical procedures where the patient cannot be repositioned. Trauma patients with spinal immobilization. Internal, open chest, CPR. White heavy checkmark definition, a highly invasive procedure where direct cardiac compressions are performed by manually squeezing the heart. White heavy checkmark steps. The chest is surgically opened, thoracotomy. The heart is manually compressed between the hands. Performed in hospital or emergency trauma settings. White heavy checkmark best suited for cardiac arrest during open heart surgery. Severe trauma, example penetrating chest injuries. Cases where external chest compressions are ineffective. CPR technique, adults, children, infants, pregnant women. Cardiopulmonary resuscitation, CPR, is a life-saving technique used during cardiac arrest to restore blood circulation and oxygenation to vital organs. The technique varies based on the age and physiological condition of the patient, such as in adults, children, infants, and pregnant women. 1 CPR in adults, above 8 years. Key points. Performed when an adult is unresponsive, not breathing, or has abnormal breathing, gasping. Focuses on high-quality chest compressions, airway management, and rescue breathing. Follows the CAB sequence, compressions rightward arrow airway rightward arrow breathing. Step-by-step technique for adult CPR. Assess responsiveness. Tap the person's shoulder and shout, "Are you okay?" If no response, call for help and activate emergency services, dial 911 or local emergency number. Check breathing and pulse. Look for normal breathing for no more than 10 seconds. Check the carotid pulse, neck, simultaneously. If no pulse and no normal breathing, begin CPR immediately. Chest compressions. Position hands, place both hands, one on top of the other, in the center of the chest, lower half of the sternum. Compression depth, at least 2 inches, 5 centimeters, but not more than 2.4 inches. Compression rate, 100 to 120 compressions per minute. Allow full chest recoil after each compression. Rescue breaths, if trained. Open the airway using the head tilt chin lift maneuver. Pinch the nose and provide 2 rescue breaths, 1 second each. Ensure visible chest rise with each breath. Continue CPR until emergency medical services, EMS, arrive. The person starts breathing and shows signs of life. An automated external defibrillator, AED, is available for use. Defibrillation, AED use. Attach AED as soon as available and follow its prompts. Shock if advised, resume CPR immediately after shock. 2 CPR in children, 1 to 8 years. Key differences from adult CPR. Children have smaller airways, so gentle ventilation is needed. If alone, perform 2 minutes of CPR first before calling EMS. Chest compressions can be done with 1 hand or 2 depending on the child's size. Step-by-step technique for child CPR. Assess responsiveness. Tap the child and shout their name. If unresponsive, call for help and activate EMS after 2 minutes of CPR, if alone. Check breathing and pulse. Check for normal breathing for no more than 10 seconds. Check the carotid or femoral pulse. If no pulse or heart rate is less than 60 BPM with signs of poor perfusion, start CPR. Chest compressions. Hand placement, 1 or 2 hands in the center of the chest, lower half of the sternum. Compression depth, at least 1/3 of chest depth, 2 inches or 5 centimeters. Compression rate, 100 to 120 compressions per minute. Full chest recoil after each compression. Rescue breaths. Use head tilt chin lift to open the airway. Deliver 2 breaths, each 1 second, ensuring visible chest rise. Continue CPR until EMS arrives, or the child shows signs of life. An AED is available, use pediatric pads or adjust shock energy for children. 3 CPR in infants, below 1 year. Key differences from child CPR. Use 2 fingers or 2 thumbs for compressions. Avoid head overextension while opening the airway. Use gentle breaths to prevent lung injury. Step-by-step technique for infant CPR. Assess responsiveness. Tap the infant's foot or shoulder and shout their name. If no response, activate EMS after 2 minutes of CPR if alone. Check breathing and pulse. Look for chest movement and listen for breath sounds. Check the brachial pulse, inside the upper arm. If pulse is less than 60 bpm with poor perfusion, start CPR. Chest compressions. Hand placement. 1 rescuer, use 2 fingers in the center of the chest. 2 rescuers, use 2 thumbs in circling technique. Compression depth, at least 1/3 of chest depth, 1.5 inches or 4 centimeters. Compression rate, 100 to 120 per minute. Rescue breaths. Open the airway with a neutral position, avoid hyperextension. Provide 2 gentle breaths, each 1 second, covering both nose and mouth. Continue CPR until EMS arrives, or the infant shows signs of life. An AED is available, use pediatric pads or manual defibrillator. 4 CPR in pregnant women. Special considerations. Aortocaval compression by the uterus reduces circulation. Perform left uterine displacement, LUD, to improve blood flow. Emergency perimotum caesarean section, PMCS, may be needed. Step-by-step technique for CPR in pregnancy. Assess responsiveness. Tap and shout. If no response, call for help immediately. Check breathing and pulse. Check carotid pulse for no more than 10 seconds. Chest compressions. Hand placement, same as in adults, center of the chest. Compression depth, at least 2 inches, 5 centimeters. Compression rate, 100 to 120 per minute. Left uterine displacement, LUD. Manually push the uterus to the left or place a wedge under the right hip. Rescue breaths. Provide 2 breaths after every 30 compressions. Early intubation may be needed to prevent aspiration. Defibrillation. Safe in pregnancy, follow AED prompts. Emergency cesarean delivery. If no response to CPR within 4 to 5 minutes, perform a perimotum C-section to improve maternal and fetal survival. CPR techniques vary based on the patient's age and condition. Adults, standard 30:2 ratio, 2 hand compressions. Children, 1 or 2 hand compressions, focus on gentle rescue breaths. Infants, 2 finger or 2 thumb compressions, cover nose and mouth for breaths. Pregnant women, left uterine displacement, possible emergency C-section. Automated external defibrillator, AED, use. Turn on AED and follow voice prompts. Attach electrode pads to the person's chest. Analyze rhythm, do not touch the victim. Deliver shock if indicated, ensure no one is touching the victim. Resume CPR immediately after shock and continue cycles. Recovery position after CPR. The recovery position is a body positioning technique used to promote an open airway and ease of breathing in an unconscious person. Take the following steps to move someone into the recovery position if they are unconscious, but breathing normally. Begin by positioning the person on their back and kneel at their side. Move the person's arm that is nearest you to a right angle with the hand pointing upward toward their head, think of a goalpost. Next, tuck the opposite hand under their head so that their cheek is touching the back of their hand. Bend the leg furthest from you at the knee to place in a right angle. Carefully pull on the bent knee to roll the person onto their side, top arm will be supporting their head and bottom arm will prevent rolling too far. Gently tilt the person's head back by lifting their chin to open the airway and check to see that nothing is blocking their ability to breathe. Stay with the person until professional help arrives. If you suspect a head, neck, or spinal injury, do not attempt to move them until emergency medical personnel arrives. Instead, leave the person face up. If you are unable to determine if the person is breathing, roll the person on their back, keeping the head aligned with the body. When to stop CPR? CPR should be stopped in the following situations. Return of spontaneous circulation, ROSC. If the person starts breathing normally and has a pulse. Signs of consciousness, such as movement or response to stimuli. Exhaustion of rescuers. If the rescuer is too physically exhausted to continue and no one else is available to take over. Arrival of advanced medical help. When trained emergency medical personnel take over CPR or declare the person deceased. Prolonged CPR without response. If CPR has been performed for 30 minutes or longer without any signs of life, and medical professionals determine that further efforts are futile. Obvious signs of death. Rigor mortis, stiffening of the body. Lividity, bluish discoloration of the body due to blood pooling. Severe injuries incompatible with life, example decapitation, decomposition. Post-resuscitation care. Monitor vital signs closely. Provide oxygen and ventilation support if needed. Treat underlying causes, example heart attack, electrolyte imbalances. Perform advanced cardiovascular interventions in the hospital. Complications of CPR. Rib fractures. Sternal fractures. Pneumothorax, lung collapse. Internal organ damage. Gastric insufflation, air entering the stomach. Aspiration pneumonia. Importance of CPR training. Increases survival rates in cardiac arrest victims. Empowers bystanders to provide immediate help before medical services arrive. Reduces brain damage caused by prolonged oxygen deprivation. Conclusion. CPR is a critical emergency procedure that can save lives in cases of sudden cardiac arrest. Quick action, proper technique, and the use of an AED significantly improve survival chances. Widespread training and awareness of CPR techniques can empower individuals to respond effectively in life-threatening situations.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.